Bismillahirrahmanirrahim. Now I am starting the unit of endocrinology, and in this we will first discuss about the thyroid disorders. What are the main thyroid disorder? It is the most important topic of the endocrinology. Thyroid diseases and is most common in our surroundings. We see many of the patients suffering from thyroid disease. Now, what are the types of thyroid disorders? There are actually three types of thyroid disorders. Now, the first is either there is the hyperfunctioning of the gland, so it would be called as hyperthyroidism, whereas there could be the hypofunctioning of the gland, so it would be called as hypothyroidism, or there could be a mass lesion of the thyroid, any tumor, any neoplasm of the thyroid. So mainly there are three kind of thyroid disorders: hyperthyroidism or hypothyroidism or mass lesion of the thyroid gland. Now we discuss mainly about the today we will discuss mainly about the hyperthyroidism and its causes and its clinical features and its diagnosis. Hyperthyroidism. Hyperthyroid. Now the one term is thyrotoxicosis. Thyrotoxicosis. Thyrotoxicosis is a hypermetabolic state which is caused by the elevated circulating levels of free T3 and T4. So what is thyrotoxicosis? It is a hypermetabolic state. Hypermetabolic state which is induced by the elevated level of free T3 and T4. Now this free T3 and T4, the raised levels of these thyroid hormones, there could be underlying three mechanisms or three causes why the free T3 and T4 level is raised. Either there would be the hyperfunctioning of the thyroid gland, hyperfunctioning of the thyroid gland, or there would be an increased release of the preformed thyroid hormones, or there would be the release from the extrathyroidal source. Release from extrathyroidal source. But in most of the cases, in about 95% of the cases, 90 to 95% of cases, in thyrotoxicosis, this hypermetabolic state, the free T3 and T4 levels, they are mainly caused due to the hyperfunctioning of the gland, which is also known as hyperthyroidism. That's why the thyrotoxicosis and hyperthyroidism, these both terms are used interchangeably. Whenever we are using the term thyrotoxicosis, it means mainly the hyperthyroidism. However, the thyrotoxicosis, it could be caused either by hyperthyroidism or increased release of the preformed thyroid gland or release from the extrathyroidal source. Now, what are the examples of the hyperfunctioning of the gland or hyperthyroidism? It could be the diffuse hyperplasia of the thyroid gland, that is the Graves' disease, or there could be the hyperfunctioning toxic multinodular goiter, or there could be hyperfunctioning toxic adenoma of the thyroid. So these are the few examples of the hyperthyroidism, the thyrotoxicosis associated with the hyperthyroidism. These three examples, These come under the heading of primary hyperthyroidism. Primary hyperthyroidism is called when there's an intrinsic abnormality in the thyroid gland itself, when the thyroid gland is actually the hyper functioning, and there's the disorder of the thyroid gland. But there could be the disorder of at the level of pituitary gland or at the level of hypothalamus, then that is known as secondary hyperthyroidism, and its example is TSH secreting pituitary tumor. TSH secreting pituitary tumor. Okay, so now next is the increased release of the preformed thyroid gland. It usually occur in case of thyroiditis, inflammation of the thyroid gland. Any it's further three types. It could be the granulomatous thyroiditis, or it could be the subacute lymphocytic thyroiditis, or it could be the Hashimoto thyroiditis. These are the few types of further thyroiditis, but mainly the increased release of the preformed thyroid hormones, it occur in thyroiditis. While in the release from the extrathyroidal source, its example is an ovarian teratoma. The ovarian teratoma, it secretes the thyroid hormones and result in the hypermetabolic state. Then that's all about the thyrotoxicosis. So what is thyrotoxicosis? It is a hypermetabolic state due to the elevated level of free T3 and T4, and this elevated level could be due to the hyperfunctioning of the thyroid gland, that is called hyperthyroidism. And there are the examples of hyperthyroidism is a Graves disease, or a multinodular goiter, or a toxic adenoma. These come under the heading of primary hyperthyroidism. And in secondary hyperthyroidism, there could be the TSH secreting pituitary tumor. While there could be the increased release of the preformed thyroid hormones, example is the thyroiditis. While there could be the release from the extrathyroidal source, there could be an ovarian teratoma. Now we discuss about the clinical features of the hyperthyroidism. Clinical features. The clinical feature, that is the symptoms of the hyperthyroidism, they could be caused due to underlying two mechanisms. The one is the hypermetabolic state induced by increased free thyroid hormone. Hypermetabolic state due to the excess of the thyroid hormone. And the second cause of these symptoms is the overactivity of the sympathetic system. Overactivity of sympathetic system, sympathetic nervous system. Due to the hypermetabolic state, there would be the increased basal metabolic rate, the increased metabolism, increased catabolism, increased anabolism. So due to the increased metabolic rate, the patient would be suffering from the heat intolerance. He cannot tolerate the heat. Even in the winters, a slight rise in temperature, he would be unable to tolerate that rise in temperature. And you will see that in winters, these patients would not be wearing the sweaters, or will not be taking any shawls, etc. So this is called the heat intolerance. And second, these patients would be having increased sweating. They would be suffering from the weight loss in spite of having increased appetite. This weight loss is actually due to increased catabolism. And these patients, their skin would be warm and red, flushing. This is due to the increased blood flow, increased peripheral blood flow, to get rid of that increased heat energy which is being produced in the body due to increased metabolism. Now next is the overactivity of the sympathetic nervous system. Due to the overactivity of sympathetic nervous system, these patients would be suffering from the tremors, fine tremors. Second, they would be having the anxiety and agitated behavior. They would be restless. Thirdly, these patients cannot sleep properly. They would be suffering from insomnia. They cannot concentrate. They are suffering from the inability of concentration. They are unable to concentrate on anything. These patients would also be having the proximal muscle weakness. This is called as thyroid myopathy. Proximal muscle weakness. Secondly, in GIT, due to the increased sympathetic stimulation, these patients would be having the diarrhea and malabsorption. The next we will discuss about this. So I am repeating again the clinical features. These are due to two mechanisms. Either first is the hypermetabolic state due to increased thyroid hormone, and so they would be having the increased BMR, heat intolerance, increased sweating, weight loss, and skin. The skin of such patients would be warm and red. And due to the overactivity of sympathetic nervous system, they would be having the tremors, anxiety, insomnia, inability to concentrate, proximal muscle weakness, and diarrhea. Now we discuss about the cardiac manifestations of the hyperthyroidism and ocular change. The first, the cardiac manifestations. In cardiac manifestations, there would be the increased contractility of heart and increased cardiac output, and this is due to the increased metabolism in the body and increased oxygen requirement. Increased cardiac output is due to the increased oxygen requirement and increased metabolism going on in the body, and as a result these patients would be suffering from tachycardia, palpitations, cardiomegaly, etc. Okay, and next these patients would be suffering from arrhythmias, most importantly the atrial fibrillation. This is the alarming situation, life threatening, may prove life threatening for the patients, this atrial fibrillation, and they would also be suffering from congestive cardiac failure. While in ocular manifestations, the eye changes, such patients would be having the staring gaze. This is due to the overstimulation, increased sympathetic stimulation of the molars muscle, which is responsible for the elevation of the lid. So there's due to overstimulation of that muscle, the lid would be more elevated than its normal position. That normally if the lid would be at this level, due to overstimulation of this muscle it would be more elevated than usual. So they would be having the staring gaze and lid lag and proptosis, that protrusion of the eyeball, mainly in the Graves' disease. So in cardiac manifestation, these patients would be having increased cardiac output due to increased oxygen requirement. So they would be having the tachycardia and palpitations, and in arrhythmias they would be having the atrial fibrillation and congestive cardiac failure. While in ocular manifestation, they would be having the staring gaze, lid lag, and proptosis. While in skeletal system, these patients have increased risk of fractures. Skeletal manifestation, increased risk of fractures, and this is due to the increased resorption of bones and osteoporosis. Now we discuss about the diagnosis of hyperthyroidism, that how you will diagnose that the patient is suffering from hyperthyroidism. Now the first is the clinical features. which we discussed previously. The clinical features: by the symptoms you can suspect that this patient might be suffering from hyperthyroidism. And the second important tool is the labs, laboratory findings. In labs, uh, the most important screening test is serum TSH levels, and the second is free thyroid hormone levels. Free thyroid hormone levels. In hyperthyroidism, because the level of T3 and T4 in the serum, they are raised, so due to the negative feedback inhibition, the TSH level would be low. While there is an exception, the TSH level may be normal or raised. In which condition? Mainly in the secondary hyperthyroidism, when there is a TSH secreting pituitary adenoma tumor. In that condition, the TSH may be normal or it would be raised. Then how we can diagnose about the secondary hyperthyroidism? We give an injection of TRH. TRH is the thyrotrophin releasing hormone. After giving this injection of TRH, we measure the levels of TSH. A normal rise in TSH after giving the TRH, it excludes the possibility of secondary hyperthyroidism. This patient would mainly be having the primary hyperthyroidism. And the fourth tool is the radioactive iodine. We measure the uptake of this radioactive iodine. We measure the uptake of radioactive iodine by the gland, and it tells about the etiology of the hyperthyroidism. If this uptake of radioactive iodine is diffuse in whole gland, okay, if there's the diffuse uptake by the whole gland, then the cause would be the Graves' disease, because in Graves' disease there is a diffuse hyperplasia and hypertrophy of the gland, so the radioactive iodine would be diffusely uptaken by the whole gland. But if the uptake of the iodine is mainly in a solitary nodule, then it could possibly the toxic adenoma. If it is only by the solitary nodule, this radioactive iodine, then the cause could be toxic adenoma. While if there's a decreased uptake, then the cause could be a thyroiditis. So I again repeat the labs of the how you will diagnose the hyperthyroidism. The first on the basis of the clinical features, and second the laboratory findings. And in laboratory findings, the most two important investigations are serum TSH level and free thyroid hormone levels. Serum TSH level would be decreased while free thyroid hormone levels would be raised. And to exclude the secondary hyperthyroidism, we give the injection of thyrotrophin releasing hormone. And in the primary hyperthyroidism, there is a normal rise in TSH level after giving the thyrotrophin releasing hormone. And the fourth is the radioactive iodine. We measure the uptake of radioactive iodine by the gland to know the underlying cause of the hyperthyroidism. If the uptake of iodine, radioactive iodine, is diffuse in the whole gland, that the whole gland uptake that radioactive iodine, then the cause is the Graves' disease. And if the radioactive iodine is uptaken by only in a focal area by a solitary nodule, then the cause could be a toxic adenoma. And if there is a decreased uptake of this radioactive iodine, then the cause could be the thyroiditis. That's all about the hyperthyroidism. Thanks for joining.